The RTSS malaria vaccine, more than 30 years in the making, changes the course of public health history.
The head of the WHO, Tedros Adhanom Ghebreyesus, says this is a game changer, not only for science, but those most affected by the disease.
This vaccine is a gift to the world, but its value will be felt most in Africa, because that's where the burden of malaria is greatest.
The WHO says there were 229 million cases in 2019, and it killed 409,000 that same year. They say children under the age of 5 accounted for 67% of those deaths, and Africa made up 94% of cases and deaths in 2019. Malawi was the first of 3 African countries to take part in a pilot program testing the vaccine on children. It meant a world of difference to those who had dealt with it firsthand.
Malaria is a dangerous disease. When I saw how ill my husband was from malaria, I was concerned that if my children got ill from malaria, it would be much worse for them. I don't want my child to suffer from malaria. That is why my child is getting the malaria vaccine.
Kenya and Ghana also took part in the program. Over 800,000 children were vaccinated with Mosquirix. The results found it to be 30% effective. That seems low compared with others, such as those for polio. Health experts say they are looking at the vaccine as another chink in malaria's armor.
I always remember when 30 years ago, we, as many others, were developing insecticide-treated bed nets, they were met with similar skepticism. But data showed that they could actually have a massive impact on mortality. And as such, they've become the cornerstone, the backbone of our malaria control efforts that have resulted in over 7 million deaths being averted.
Challenges lie ahead in getting this vaccine out. It means delivering it to the most remote parts of a massive continent. But for the WHO, it's worth the cost to save lives. Timothy Ulrich, CGTN.